Great, thank you, Anu. The next question is for Dr. Baldwin. We have received a ton of questions about cloth face coverings and students wearing them on campus, and if they should be required or if they should be recommended, and how they will be supplied. Do you have comments about the recommendations for wearing cloth face coverings, Dr. Baldwin?
Yeah, I do. Thanks for the question, Christy. I want to start, though, by emphasizing, making a point about all the considerations that Anu walked through. The success that we'll have collectively with our mitigation efforts is when those strategies that she outlined are sort of layered or stacked on top of one another. So each of the strategies alone confers some level of protection, but it's really when you layer and stack them on top of one another where you really see the collective impact. So I want to make that point. The other point I wanted to make is to clarify, there was, we recently put out some transportation associated considerations with a focus on, that had some elements of focusing on mass transit. And we gave some specific guidance. So for faculty, staff, students, and others who have to travel to campus or to your facility via mass transit, there are some specific considerations that can be put in place so that they can do so as safely as possible. In terms of cloth face coverings, your question, those are really meant to protect other people in the case the wearer is unknowingly affected. They actually serve as source control. So when feasible, we do recommend that staff and students should wear face coverings, especially when physical distancing is difficult to maintain. And IHEs should provide to staff and students instruction on proper use, removal, and washing, and some of that information is available online. And Christy, I know you followed up with me earlier today about some additional questions that came in. One was associated on whether or not students and others should be able to opt out of wearing face coverings at their own risk in writing, and what I thought about that. And the reality is, it's our hope and expectation that over time the use of cloth face coverings will become a social norm and an expectation, and especially among the population of students and staff and faculty that work at IHEs, we think it's every expectation that those norms should be followed to the largest extent possible. Again, when that that's really most critical when physical distancing can't be maintained. So let me stop there. I'm looking at the other. Yeah, and the other point I wanted to make on another question you sent me this morning, Christy, was around, what level of, do they need an N95 mask, if you will? And the reality for us, I think right now we're just recommending the use of cloth face coverings for source control.
Great, excellent. Thank you, Dr. Baldwin. We have another question for you, which we're seeing a lot in the chat box right now and definitely came up prior to the call, is about universal testing, and if universities should conduct universal testing for their students, staff, and faculty, and if so, how often, and sort of what are the recommendations around that?
Sure, yeah. So right now, our published considerations do not include universal testing for students and staff prior to returning to campus. We are aware that there are some universities that are considering this, but in general, we think this is a state and local decision, and so we encourage you to stay in touch with your state and local authorities to determine your current situation in your community and who should be considered the highest priority for testing. But again, focusing on those who are infected. I will say, and this really is a late breaker because we had conversations this morning internally here at CDC around needing to add some additional information into our considerations, specifically focus on testing of students and faculty and staff in the situation where somebody does test positive for COVID-19, and what protocols need to be put in place for outreach and testing therein. And we're hoping, we're in the process of developing that. I think it will likely come out in the next few weeks. I know it's a source of energy or a source of interest among a lot of folks on the call, so stay tuned for that. I would say that the other thing that's in our considerations now that I want to emphasize is that once students and staff are on campus, we are encouraging, I think we're seeing this more commonly in workplaces, and I know schools, other K through 12 schools are considering this as well, as sort of daily health checks, if you will. They should be considered to ask faculty, staff, and students to either conduct self-checks, sort of temperature screening and symptom checking, or have some protocol put in place for those health checks to be done. So the short answer, Christy, is we're not recommending universal testing to return to campus. We are in the process of adding some additional information to our considerations in the coming week or couple of weeks around testing and circumstances associated when somebody is identified as COVID-19 positive.
Great, thank you. I know a lot of people will be looking forward to that coming out. So somewhat of a related question, you mentioned recommending screenings. So we also heard earlier that sometimes people have the virus and they're asymptomatic. So should we be concerned about asymptomatic transmission, and does this impact the recommendations for screening at all?
Yeah, so here again, we're still learning more about asymptomatic transmission and what symptoms are more or less contagious. But somebody who is asymptomatic, as you heard earlier, can spread the virus. And frankly, that's why we're one of the reasons we're recommending the use of cloth face coverings. Again, cloth face coverings may prevent people who don't know that they have the virus from transmitting it to others. As I said, it's really a source of source control. So every time we cough, sneeze, or breathe, we are, again, sharing our germs with each other. And a cloth face covering really helps keep those germs and the potential COVID-19 virus from spreading to others. So it's really that wearing of cloth face coverings that protects those of you around you. And so in my judgment, given the asymptomatic transmission, that's frankly why I think a lot of us have a sense of urgency, if you will, around the importance of supporting the use of cloth face coverings. Again, especially when physical distance is hard to maintain.
Thank you. And another question for you, Dr. Baldwin, is around what should institutions do if a resident or a student has COVID-19, is confirmed to or suspected to have COVID-19. And related to that, there's a lot of questions that are coming through in the chat box about is the university responsible for notifying officials and how that should be done?
Yeah, so I think the first thing a resident should do is seek advice by telephone from a healthcare provider to determine whether a medical evaluation is needed. And faculty, staff, and students may consider notifying university officials if they become sick with COVID-19 symptoms, test positive for COVID-19, or have been exposed to somebody who has COVID-19 symptoms or is a confirmed or suspected case. Again, we would encourage residents with COVID-19 symptoms and their roommate in close contacts to self-isolate and limit their use of shared spaces as much as possible. And if possible, designate a separate bathroom for residents with COVID-19 symptoms. Consider, of course, increasing the cleaning frequency in bedrooms and bathrooms dedicated to persons with COVID-19 symptoms. Consider reducing the cleaning frequency of bedrooms and bathrooms dedicated to persons with COVID-19 symptoms to as needed, to avoid unnecessary contact with ill persons. Again, follow the guidance of when to stop isolation. It's important to minimize the number of staff members who have face-to-face interactions with residents who are either suspected or confirmed COVID-19 positive. So, and staff at a higher risk of severe illness from COVID-19 should not have close contact with residents who have suspected or confirmed COVID-19, again, if possible. And those who have been in close contact, that is to say less than 6 feet or 2 meters with a resident who are confirmed or suspected, should monitor their health and call their healthcare provider if they develop symptoms suggestive of COVID-19. Of course, be prepared for the potential need to transport persons with suspected or confirmed COVID-19 for testing, or non-urgent medical care, and in doing this, avoid using public transportation, ride-sharing, taxis, etc., and then following the guidelines that we have online for cleaning and disinfection. So I think one of the things that I'd also recommend is that, I think many institutions are putting in place sort of COVID-19 coordinators, if you will. I think it's important to develop university or IHE-wide protocols for who serves as point of contacts and how to do some of that triaging and make the connection between the university or the institution and local health officials to sort of be that sort of consistent and persistent bridge and share information as is appropriate and allowable by federal, state, and local law, but just doing everything that we can to manage those situations appropriately.
Excellent, thank you. Our next question is for Anu, and this is related to sort of shared spaces that, of course, are very common in institutes of higher education. And so there's been some questions about how these places can keep recreation areas and shared spaces such as activity rooms and exercise rooms safe.
Yeah, thanks for that question, Christy. Yeah, IHEs can consider closing activity rooms or exercise rooms, or if not closing, maybe restricting the number of people allowed at one time to ensure that everyone can stay at least 6 feet apart. And really, when thinking about like specific activities or sports and which ones might present more risk than others, just really always think about the more people the individual interacts with during a sport or activity, that the closer that physical interaction, the more they share any equipment, and the longer that interaction, all of those things add up to a higher risk. So really the risk of spread can be different depending on the type of activity or sport. So just keep all of that in mind as thinking about which activities to perhaps close or restrict or limit to a few people.
Great, thanks. And the next question is sort of a follow-up to that one, also for you, Anu. What about shared dining rooms and kitchens? Are there any things that people should keep in mind related to that?
Yeah, it's kind of a similar response. You know, when you think about like a shared kitchen or a dining space in a dormitory, for example, consider restricting the number of people allowed in that space at a time so that people can be physically distanced at least 6 feet. And people who are sick, their roommates, and those who have higher risk of severe illness should eat or be fed in their room if possible, and really avoid sharing dishes, drinking glasses, cups, or utensils. And when possible, non-disposable food service items could be used and handled with gloves and washed with dish soap and hot water. And of course, wash hands after handling any food service items. Use gloves when removing garbage bags and handling and disposing of trash.
Thank you. So the next question, we're switching gears a little bit, and this is directed towards Dr. Murphy. And we've seen some questions about some recent news reports that the virus might not actually spread from people touching surfaces, and is it still important to clean and disinfect surfaces as had been recommended?
Sure, yeah, thanks for that question. So CDC's guidance regarding cleaning and disinfecting surfaces has not changed. As we know, COVID-19 is a new disease, and so we're still really learning a lot about how it spreads. So we know it may be possible that a person can get COVID-19 by touching a surface or an object that has the virus on it and then touching their own mouth or nose or possibly their eyes. This is not thought to be the main way that the virus spreads, but again, we're still really learning about how this virus works. So what we recommend is routinely cleaning and disinfecting frequently touched surfaces. And this is, we recommend using a product from EPA's List N, which is disinfectants for use against SARS-CoV-2. And it's still really one of the best ways to prevent the spread. So for those surfaces that are frequently touched by multiple people, those are things such as door handles, tables, light switches, bathroom faucets, and those are things that we recommend cleaning and disinfecting at least daily. But there could be a need for more frequent cleaning and disinfection. So it's really based on the level of use. Every location, of course, is unique. So I think it's really important that directors and administrators work together and assess the high-touch surfaces in all of their facilities, and from that can develop a cleaning and disinfecting schedule that's tailored to that particular setting. I will point you to some guidance. Recently, CDC, along with EPA, developed some guidance to help facility operators and families clean and disinfect spaces. So this guidance provides a lot of information for those kinds of spaces, public spaces, workplaces, businesses, schools, that kind of thing. And it falls in line with the Opening Up America Again guidelines. So you can find some more detailed information on that on our website.
Thanks, Dr. Murphy. Another question for you related. Given that university students are oftentimes sharing bathrooms in residence halls, is there any specific recommendations for cleaning shared bathrooms?
Sure. So this kind of goes along the same lines as of what I was just speaking about with the high-touch surfaces. So shared bathrooms should be regularly cleaned with soap and water, and then a disinfectant from that EPA list I mentioned should be used. We say at least once per day, but again, more frequent cleaning and disinfection might be required based on how often that space is used. So for example, in a shared bathroom, it may be a schedule of in the morning and in the evening, and then after times of heavy use. So it really just depends on how frequently that space is used. I think it's important to also make sure that those bathrooms are continuously stocked with soap and paper towels or automated hand dryers. You could also consider making hand sanitizer that contains at least 60% alcohol that's available in the bathrooms. Make sure the trash cans are emptied regularly. Can provide information on how to wash hands properly. You can hang some signs in the bathrooms, and CDC has a number of print resources online for that. I think it's also important that residents be instructed that sinks could be an infection source, and so they should avoid placing things like toothbrushes directly on counter surfaces. Totes could also be used for personal items just to limit that contact with surfaces in the bathroom.
Great, thanks, Dr. Murphy. And in the spirit of staying on cleaning and disinfection, you talked about routine cleaning and disinfection. We've also seen a lot of questions come through about what the procedures should be for cleaning and disinfecting after a COVID-19 case has been confirmed. And then a couple of questions came in last night about the rationale for waiting 24 hours to clean, and does this apply to all settings, including residence halls and classrooms?
Sure. So yes, again, I'll just point you to that CDC EPA guidance that we've developed. It really provides a lot of information about how to do this cleaning and disinfecting. So the first thing we do in a space where there has been a COVID-19 case is we recommend closing off that area that was used by the person who is sick. So you don't necessarily need to close down your entire operations if you're able to just kind of close off that one particular affected area. We recommend that if possible, you open up outside doors and windows, and this increases air circulation within that area. And then of course, yes, we do recommend waiting 24 hours before you clean or disinfect. We know that's not always feasible, so if you can't wait 24 hours, it's good to wait as long as you can. So the reason that we recommend this 24-hour period is because we still, again, don't know a lot about the virus. We don't know how long the air inside a room that was occupied by someone with a confirmed COVID-19 infection remains potentially infectious. So for indoor areas, facilities could consider factors such as the size of the room, the ventilation system, so this is the flow rate and the location of the supply and exhaust vents, when they're deciding how long to close off rooms or areas that these ill persons were in before they begin their cleaning and disinfection. Again, taking measures to improve ventilation in the area or the room where someone was ill or suspected to be ill will help shorten that time it takes to for these respiratory droplets to be removed from the air.
Great, thank you. So the next question is directed to Dr. Baldwin and is about what should we do if a student or staff member who has recently traveled to an area with COVID-19, or someone who has a family member who has traveled to an area with COVID-19, are there any specific precautions we should take?
Yeah, thanks for that question, Christy. Let me say first, I want to thank everybody for putting in all your questions in the Q&A box. One of the things, we're going to try to get to some of them once we go through the ones that were sent in already. But I did want to recognize to you that we will be looking at all of the questions and using them to inform additional resources that we'll be developing. So the question on sort of what we should do if a student or staff member has recently traveled to an area that's with greater COVID-19 transmission, review the updated CDC information for travelers guidance, including we've got some great FAQs. Of course, consult with your state and local health officials. The local health officials may use our interim guidance for risk assessment and public health management of persons with potential COVID-19 exposure and travel associated with travel or associated or community settings to make specific recommendations to your area. But individuals returning from travel to areas with community spread of COVID-19 really must follow the guidance that they've received from local health officials. I think some of the additional, I think this is where we need a special vigilance to some of the considerations that we've outlined over the course of the call. You all as administrators need to make some decisions about how you can really encourage and strongly promote some of those behaviors, because that's ultimately what's going to stop if they did go to an area of still elevated community transmission, stop it from spreading.
Thanks. So another question for you, Dr. Baldwin, you and Anu touched on this a little bit in your earlier comments, but when assuming that an institute of higher education starts back up, when should they make a determination to suspend classes or cancel scheduled events or activities that are going to happen on campus?
Yeah, that's a tough question. Really, any decision about school dismissal or cancellation really should be made in close coordination with local health officials. I don't think the colleges and universities are certainly not expected to make decisions about dismissals on their own. Of course, again, depending upon the extent to which there are COVID-19 positives on campus and the number of individuals, you may need to temporarily dismiss classes or events for a few days. If somebody that was COVID-19 was on campus, to do some of the sort of basic bootstrap public health in terms of contact tracing. This initial short-term dismissal, frankly, does allow time for local health officials to really get that better understanding of the COVID-19 situation that might be impacting the school, and for, frankly, the custodial staff to clean and disinfect the affected areas in much of the ways that Dr. Murphy just outlined. So again, working with local health officials to determine the appropriate next steps and whether an extended dismissal duration is needed to stop or slow further spread of 19, that's really what we'd recommend. Again, if there's substantial transmission in the local community, local health officials may suggest extended school dismissals, but that's really a conversation that needs to be had between the institution and the local health authorities and others.
Thank you. So the next question is for Anu, and Dr. Baldwin had touched on this a little bit earlier, but are there any specific safety practices that should be followed for buses or other vehicles that are being used to transport more than one student or staff member?
Yeah, thanks for that, Christy. I know we got that question yesterday, so would be happy to address that. Really, for bus drivers themselves, potential sources of exposure include having close contact with a passenger with COVID-19, or by contacting surfaces touched or handled by a person with COVID-19, or by touching their own mouth, nose, or eyes. So really, all frequently touched surfaces on buses and vehicles transporting students and staff should be cleaned between use as much as possible, and at least daily. When possible, windows should be open to allow for airflow and to improve ventilation. And consider spacing riders out, such as by skipping rows or having individuals sit one per row, as much as possible to increase that physical distancing. And all drivers should also practice the same safety practices we've talked about for other staff as far as hand hygiene and cloth face coverings.
Great, thank you. So this is another question for you, Anu, related to meal times or food service in large settings within universities and colleges. And are there specific modifications that these places should take to help prevent transmission?
Sure, yeah, and I'm sure some of us that are on this call have gone into restaurants or bars in our local areas and have seen some of these measures. So some of them can be also applied to dining halls and restaurants on campus. So things like staggering use and restricting the number of people allowed in at a time to ensure that physical distancing of 6 feet apart, and just being really on top of cleaning and disinfecting between use. Thinking about physical barriers such as sneeze guards and partitions, particularly in areas where it's difficult to keep that 6 feet apart distance. Barriers really can be useful in kitchens and at cash registers or food pickup areas. When possible, maybe providing grab-and-go meals or serving individually plated meals instead of a buffet-style meal service. And really trying to avoid self-serve food or drink options, salad bars, drink stations, things like that. Consider using disposable utensils and dishes. And if disposable is not feasible or desirable, ensure that all the non-disposable food service items are handled with gloves and washed with dish soap and hot water. And individuals really should be washing their hands after removing their gloves or after directly handling used food service items. And again, as I mentioned, just cleaning and disinfecting is of the utmost importance, especially for frequently touched surfaces like door handles, cash registers, workstations, bathroom stalls, and trying to do that at least daily or as much as possible and is required by food safety requirements. And thinking about shared objects such as payment terminals, tables, countertops, receipt trays, condiment holders, just thinking about all of those surfaces that might exist in a dining hall or food service establishment. And then just other sort of physical guides, such maybe on the floor, such as tape or signage to ensure that individuals remain 6 feet apart. And I also want to note that we have even more information on safe practices for food service establishments. And some of that is on the CDC website. We also have additional resources on the FDA website. So CDC has considerations for restaurants that could be applicable, and the FDA has a checklist and an infographic designed to assist retail food establishments that might have closed as they now prepare to reopen. So those are some resources you might consider accessing if you're thinking about your food service establishment.
Great, thank you. So another question for Dr. Baldwin. So you earlier answered a question about if people have traveled to a place affected by COVID-19 or has a family member who has traveled to a location. So are there any recommendations for managing housing for students who are arriving from international locations in general?
Yeah, thanks, Chrissy. Yeah, so students arriving from international locations are really recommended to isolate at home for a 14-day period, and it's really up to IHE administrators and officials that they may consider whether it's appropriate or feasible to identify an isolation room, an area, a building floor, and a campus housing to accommodate anyone who's arriving from an international location to observe that 14-day isolation period. So. But while they're isolated, return travelers should take their temperature with a temperature 2 times a day and monitor for a fever. Also watch for a cough or trouble breathing. They may want to use a temperature log to monitor their temperature and to stay where they, stay home and avoid contact with others. They should not obviously go to work or school until they've completed that isolation. Of course, avoid public transportation, taxis, ride shares. And again, that physical distance is going to be critical. So again, folks arriving from international locations or frankly other areas that have very high sustained community transmission, I think we need to be thinking creatively about what measures can be put in place to make sure that they don't introduce additional spread onto a campus.
Excellent, thank you. So the next question is for Dr. Murphy, and this is related to ventilation systems. And are there any recommendations or what types of ventilation systems should be used in university settings?
Sure. So the risk of spreading the virus that causes COVID-19 through ventilation systems has not been studied yet, but we think it's likely low. Routine HVAC maintenance, of course, is recommended. Although it's never the first line of prevention, there are some considerations, some ventilation adjustments that you can use in your workplace, such as increasing the ventilation, increasing the amount of outdoor air that's used by the system, and then maintaining the indoor air temperature and humidity at comfortable levels for the building occupants.
Thank you. The next question is for Anu, and it is about this being a very stressful time. I think we can all appreciate that this is a stressful time, you know, for faculty, students, staff, parents, really everybody right now. Is there any recommendations for how to support coping and resilience among people who are involved with institutes of higher education?
You know, that is so important, Christy. I'm glad you raised that. And yeah, I think IHGs really have such an opportunity to support coping and resilience among staff and students. I mean, I like you said, we know that fear and anxiety about a disease can just be overwhelming and cause strong emotions, both in adults and young adults. And so some of these stress responses might be fear and worry about their own health and the health of their loved ones, changes in sleep or eating patterns, difficulty sleeping or concentrating, perhaps on schoolwork, worsening of chronic health problems, worsening of mental health conditions, and even potentially increased use of alcohol, tobacco, or other drugs. So, you know, IHGs really can try to encourage students to call their healthcare provider or the student health center if stress is getting in the way of daily activities, in particular for several days in a row. And think about how you can support your IHG community by encouraging staff and students to be doing all the things we know we should be doing, you know, eating healthy, exercising, getting sleep, finding time to unwind, and making sure everyone just has someone to talk to, encourage them to talk with people they trust about their concerns and how they're feeling. And, you know, even consider encouraging them to take breaks from watching, reading, or listening to news stories about COVID-19, including maybe social media if they're feeling overwhelmed or distressed. Because we really do need to support our college and university communities in this space.
Thank you, Anu. Yes, that is extremely important. So another question for Dr. Baldwin, circling back to some of the discussion earlier about cloth face coverings. We've seen a couple of questions about if a face shield would be an acceptable alternative, and this is particularly, or in some cases, related to when students are hearing impaired and might need to be lip reading. So is a face shield an acceptable alternative?
Yeah, I mean, I think we're constantly looking for ways to make sure that folks are protected, and I know that some of the cloth face coverings that are being made now allow for folks who are hearing impaired to see the lips of other people. So I think there are some accommodations that can be made. Obviously, right now we're recommending the use of a cloth face covering, but I think it's the you know, any level of protection I think is certainly helpful. Yeah, I think I'll leave it at that. I don't know if others on the phone have other things to add.
Okay, great, thank you. One last question we have is related to social distancing and sort of if there are any additional recommendations when you're considering specific kinds of classes that might make it particularly hard to maintain the 6 feet of distance, such as truck driving classes, dance classes in some cases, stage combat, acting classes, laboratory settings has come up a lot, beauty schools, and any other sort of place that might require more close interaction. And this is for you, Dr. Baldwin. Thank you.
Yeah, thanks. So, you know, I think we need to consider ways that the college or university can adapt or use alternative teaching methods. Again, that this could include, so how to convert face-to-face lessons into online lessons and how to train faculty and staff to use those platforms more. I think we're all getting better at it by the day, if you will. Of course, if there's technical issues that come up in those online environments, how can you basically make sure that the IT infrastructure and staff support is available to attend to that. And again, there's obviously issues about how do you deal with potential lack of student access to computers and the internet at home and temporary housing. All these things need to be sort of wrestled with and resolved. But some approaches you might want to consider use existing infrastructure and services. So Blackboard, Skype, Zoom, Canvas, etc., to support efficient transition of classes from in-person to distance-based formats. And this may include strategies such as faculty check-ins, recording class meetings or lectures, and of course, live class meetings. I teach myself in the distance environment and have found these tools extremely useful. And of course, enabling other student support services such as online library services, making print materials available online, providing phone or internet-based counseling support, and again, creating study groups through digital media. I think one of the big take-homes from today's conversation is innovation, creativity, looking for ways to layer and stack those protections on top of one another is really what we're aiming for. We think there are ways in which we can perhaps not make it just like it would be to be in person with some of these classroom experiences, but to the extent that we can adapt and adopt some of these virtual opportunities, especially as you indicated, Christy, in circumstances where maintaining that physical distance is difficult. I think that's really going to be optimal.
Excellent, thank you. And thank you so much to all of our panelists who have been here with us today. Thank you for everyone who joined the call to listen. Thank you for your questions. As Dr. Baldwin mentioned, we will be looking at those questions and using them to help shape some of our actions moving forward. So thank you for that. We do have a homepage or a landing page that does have resources for institutes of higher education, along with some other resources. So thank you everyone for joining today. Have a wonderful weekend, and thank you.